of fundamental and real healthcare reform. My question is, are you willing to support a bill that would not include a public option?
You are entitled to a completely honest answer. I'm going to give you a completely honest answer. My belief is that a public option is fundamental to this. Number one, I have seen what happens when people do not have choice. And in many parts of America, there might be only one, maybe only two insurance companies that's even in the market. And those people are prisoners of those particular...
Yes!
Giving people a public option, I think, makes all the sense in the world. Number two, I think it has the capacity to help drive down the rate of medical inflation. We have to drive down the rate of medical inflation, or this country will go bankrupt. Number three, the way we have structured the public option, it is not going to be some sort of government takeover of medicine. For this reason, it will be financed by the premiums of only the Americans who choose to exercise that option. One of the great values, I believe, of the proposal that is now on the table is respecting Americans' right of choice. And this reform issues the choice for every American where to receive their health insurance, including a public option. So for those three reasons, but I will tell you this, I'm not doing pledges until I find out what is in the bill. I will do everything within my power to do a public option. I hope it's in the bill, I will fight for it, and I look forward to seeing you in the South Lawn of the White House to sign this bill.
I have just one suggestion to all of you who oppose healthcare reform. If you are healthcare paid by the government, on Medicare, on Medicaid, give it up. All these programs are run by the government. How about public schools? How about all other programs that are paid by the government? So don't be a hypocrite. Don't go to get the Medicare, but at the same time you're against Medicare. The United States is the third country that I lived in. I lived in communist Poland and in Austria. And I have to say that this country is the most difficult for families to pay for daycare, for healthcare. When I lived in communist Poland, the hospitals could not offer much, really very little. But whatever was available to everybody. And this is...
Very nice!
There's no communism in Poland anymore. I don't go back.
I have a question regarding who's going to be covered with this. We know what Indian care and military care is, Army Reed Hospital being an example. And I want to know if this is such a good program, if you're going to be on it.
Members of the U.S. Congress will be subject to all of the rights and liabilities of this bill, every jot and tittle. And I hope that will please you. As will our children, as well as our neighbors, as well as our mother-in-laws will also be subject to it. So we won't provide that. To the 99% of the people in this gym who are respecting each other's neighbors, I want to apologize to you for some of the boorish behavior of the others.
I went to two podiatrists, one, anyway, I had toe problems, and they looked at my toe and they said there's nothing wrong. Well, eventually, I picked up my toe and there was a wart there. None of the 3 doctors found this wart, so I took care of it myself. I went to another doctor. I had urinary tract infection, so I talked to him. And I also had bites on my arm, and he said those were bed bug bites. I looked him in the eye and I said, you mean to say I lived in the same apartment for 20 years, had my same bed for over 50 years and mattress, and I have bed bugs? I found out that he was from Florida, so they have bed bugs down there. I went to another doctor and he put me on oxygen. I didn't need the oxygen. That's another fraud. And I went to another doctor for a problem. He told me I had diabetes.
We're running out
I
of
went and
parts
had
here.
my diabetes checked. I don't have diabetes. This is one more thing. I received a Goodwill card from a friend of mine that had pictures of ducks swimming in a pond. I opened up the card and it said, all doctors are
I
quacks.
hope that this healthcare bill is a start towards getting it right, because in my own family, my sister-in-law, she's in her 40s, really healthy woman, just had a double bypass. The bill was $140,000. No family can afford $140,000. That's crazy. And my aunt, Phyllis, who was married on Mark 45 years, went to early Alzheimer's, and the first thing they advised her to do was to divorce him so she could retain her 401k. I'm sorry, we're in crazy town. All I'm going to say is that other countries are paying thousands less per person and getting better care. So, I don't know if this healthcare bill will do it, but we've got to make a start. Every 30 minutes, an uninsured American is dying.
Just one comment about the ability to deliver high-quality medicine at a reasonable price. What I have discovered is Americans can provide high-quality medicine at a reasonable price because they're doing it here in the state of Washington. If you look at that chart of the disparate costs of healthcare in this country, what we want to do in this bill is to spread some of the ideas that we have implemented here in the state of Washington and around the country. And if we do them, people in Florida, and New York, and McAllen, Texas, are going to get better quality care, perhaps at half the price, and we will get a break on our taxes as a result of that. Now, I want to tell you one way we're doing this. I alluded to this deal we reached. We have negotiated successfully in the House bill. There will be a provision that will essentially say in 2 years, the Secretary will need to reinstitute a new method of reimbursing. So we have reimbursed doctors for value rather than volume. Because when we reimburse people for value, rather than volume, we get better care and better value. So we are capable of reducing that. Good luck to your family. I know we all care about it.